another lesson to our audience out there. I had thought about doing this ahead of time, but Dr. Conejo here really brought up a great point that I really didn't. Most implant places, you guys know this, right? The TV commercial places you see on TV rarely, they're more of a hammer to a nail type deal. Everybody's an All-On-X recipient, right? That as long as you got, we can pull any, all your teeth and bottom, you don't like them, we'll put it in an All-On-4. We'll rip out what you got and, take the remaining teeth. And so there's rarely that hybrid, and yet as a patient, you want to go to a specialist for the All-On-X. You don't want to go to just a general dentist, in my opinion. That's my recommendation. I really think a highly trained the prosthodontist, the understanding in oral, which you also are a surgical prosthodontist. You do both the surgery and the restorative. Having somebody who has that higher education, but rarely is it talked about at implant centers where you go, they don't normally ask about that. So I want to encourage you guys on asking, if you choose to go to a place that is an implant center and they're highly trained specialists, it might be good to seek out another prosthodontist because they do the restorative, right? That's what a prosthodontist does.
Mm-hmm. Exactly.
They focus on the whole mouth, smile, look, complete, finished work. It's not just the tooth design. They look at the whole mouth design, right?
Correct.
And so would you want to go to a prosthodontist for veneers? Where would you want? Is that what you'd want to do? Is if you can, and they're going to be a little more expensive probably because they're a specialist, but would you want to then hook them up with the implant center? If you're wanting to plan that, if you're in a perfect world, you would go to the implant center and they'd say, yes, you're a candidate, you got enough bone, you're okay, we like it, we'll start the case planning process. At what point in that process should I go meet if that implant center doesn't do veneers much or at all? At what point in the process am I going to want to go meet that other prosthodontist to then start hook them up?
Yeah, from the beginning of the treatment planning phase. So that was something that used to happen years ago very often, and many complications came because the vision of the person placing the implants was just more on the surgical aspect, and the aesthetics and functions were not considered from the beginning. So if that implant center has a prosthodontist or restorative dentist, that person for sure needs to be there since the beginning, because at the end implants are only a foundation for the teeth. We all are looking for our nice and functioning teeth, right?
Want them to look good.
Yeah, exactly. So we gotta, like an architect, start planning the outside of that house or building and the proportions and then go to creating a solid foundation for this plan. So it's from the beginning, and treatment planning, interdisciplinary dentistry, that's the way it has to be.
Okay, so let me give an example for maybe our viewers to help understand this. If you're gonna build a house and you have the money to do it, and you say, I want to build a house, and maybe someday I got enough money to build a house right now, but I want a pool. So I'm going to go ahead and make sure my lot size and where the house is and all that kind of stuff is in, and the layout of the lot is designed, even though it might be grass and a garden for now, that when the time comes, it's already prepared for that pool, versus buying a house because you love it and then trying to go, what look nice here, a pool, and then now you're trying to worry about pipes and all this kind of stuff to make it. Is that a decent analogy?
Exactly, that's the best analogy for that case. And not everything needs to be done at the same time, because sometimes that might be a big investment. But if properly treatment planned, we can have a sequence, and at the end, you're going to have with the ideal final outcome without having to have everything done at the same time. So that's something totally valid, and it's actually very easy to accomplish that ideal final result with a good stage approach.
And I know I'm confident with Dr. Ratana and Dr. Skinner that, you know, they knew, even though I didn't say where's my plan for my veneers, but they knew that I was going to do something along those lines on the veneers side of things. So I'm not worried about it, but I almost wish I would have discussed it probably a little more. So for our patients out there, if you're like me, you only need the upper, right, or even the lower, now all of a sudden you've got an additional option of saying, hey, do you have a prosthodontist? And if there is and there should be on the team. I'm a big proponent of a prosthodontist being on the team, I'm telling you, and letting them know up front, hey, maybe I've only budgeted and saved for the top row for now, and then now, you know, in about a year or so or two, doesn't matter really at that point, ultimately, that you can say, hey, I'm probably going to get veneers, know that going into it up front. Correct?
Correct.